This is All Things Fitness and Wellness, uniting industry thought leaders and fitfluencers on the mission to inspire innovation and encourage people to live a life fit and well. Brought to you by Fitness World, your fitness, your way. Visit fitnessworld.ca. Mental health is one of the top reasons people say they exercise. And when it comes to taking care of your mental wellness, there are many avenues that you can turn to. But there's one in particular that continues to garner a lot of attention, and that is psychedelic therapy. Professional athletes like Aaron Rodgers and Kenny Stills have opened up on their use of it for mental health purposes. So could there be a space for this in sports and athletics, or something that becomes part of people's self-care? Well, we're going to be diving right in today and talking to Dr. Devon Christie. Dr. Christie is a family physician, certified functional medicine provider, registered therapeutic counselor, certified mindfulness-based stress reduction teacher, and yoga teacher. And those are just a few of her qualifications. Dr. Christie currently serves as medical director for Numinus Wellness Inc, which is a Canadian company that aims to advance psychedelic therapy, treatment, and research. Our conversation together was nothing short of fascinating. But before we get to it, be sure to hit like, comment, and subscribe. We have new podcast episodes every Wednesday. This is ATFW. First of all, Dr. Devon Christie joining me. Thank you so much, because this is a topic, as I was saying before we started here, personally makes me so excited, because I think the science that is coming up now is something that is truly going to change the world in a time that we need it most. So let's start with what you've seen in regards to the mental health climate, particularly over the last couple of years where mass populace spent a lot of time in isolation.
Well, we've seen a global crisis only get worse, right? Because mental health and addiction has been something that has plagued society all around the world and here in North America for quite some time, with not a lot of resources actually being offered through our healthcare system towards mental health. And then enter a global pandemic that has only increased isolation, people being sequestered, fear of one another. And some of these factors are huge factors in the mental illness crisis in the first place. So unfortunately, we're at a very dire time right now.
Absolutely. And, on ATFW, we talk a lot about wellness, and we speak a lot to the importance of physical activity. We know there's tremendous mental health benefits there. We speak about making space for self-care, but I find it interesting when it comes to mental health, and it's something, thank goodness, the stigma and tides are changing. It's a conversation coming more to the forefront. However, we don't look at it as something that requires maintenance. The dentist, we do preventative care, but for some reason, our mental health, we don't. So why is it so important to take charge of our emotional well-being, bearing in mind not everyone has the capacity to do so in the moment?
Yeah, it's funny that you use that analogy of going to the dentist, because that's the same analogy I use a lot when I'm talking to patients of mine, like in my medical practice, about the importance of attending to mental well-being. It just has the stigma still attached to it. And I think part of that is because of the way medicine pathologizes mental illness versus really coming from a more wellness perspective, like you're speaking about, in terms of how can we be optimally well and what are the pathways to that, and maybe seeing a therapist or a coach or someone on a regular basis could be as normal as seeing your dentist for your routine hygiene. And I think what's really important to recognize is that there is no split between our mind and body. And the biomedical paradigm of medicine has really focused in the last century and more on physical parameters of our well-being and really dissecting down to the molecular level and cellular structures and understanding life from that way, which is fascinating and wonderful. However, there is so much research now in the field of psychoneuroimmunology, psychoneuroimmunoendocrinology, just showing that, literally our cells are listening to our thoughts, right? The climate inside our being is affected by everything around us, and also how we are perceiving and responding to the world around us and inside. So when we are in a negative mental space, there's chemical and hormonal cascades that correlate with that space. When we're feeling grateful or when we're feeling joyful, there are different chemicals and hormones that are happening simultaneously there. And those signal messengers, they impact our cells, they impact the health of our body. And we know from research that these positive mental states have direct implications for our wellness. So really we need to start to look at what's causing stress, what's causing mental states that are actually contributing to wear and tear on our physical well-being that we actually have some control around. And maybe it's about learning the tools, maybe it's about digging deep and doing some maybe difficult inner work, but having the support to do that. And I think once we start to gather these pieces into how we approach health and well-being, we're going to have a much more holistic way of approaching things, and people are going to be happier and healthier.
And that really is the ultimate goal. I mean, you even think of the word disease, dis-ease in the body. And that's something that can be difficult for people to look at. And this is where things get interesting. There is so much exciting science that is happening in the world right now. And I think one of the really exciting things about it, a lot of leaders and thought leaders here in Canada around the world of psychedelics. And we know that a lot of this science isn't new. It was really progressing in through the 60s and 70s, and then we saw the war on drugs that took that all down. Mm-hmm. The tides are changing now at a time that, my personal opinion, I think we couldn't need it more because there is a mental health crisis on our hands. But I know that there is an even bigger stigma attached a lot of times to the world of psychedelics. So first of all, help people understand, what is psychedelic integration?
Well, psychedelic integration, I would say, integration is a phase of the arc of working with psychedelic medicines consciously. Integration is the part that happens afterwards, where you're really taking any insights, meaning, experiences that you've had during the experience with a psychedelic, and really weaving it into your life, bringing it into your body, into how you're going to maybe change your behaviors going forward. Integration is also about working with and even metabolizing some of the content that might have surfaced that might have been surprising or difficult in a psychedelic experience, continuing to work with that and make meaning of it. Psychedelics can cause profound shifts in how we see ourselves or how we relate to the world and our lives. And so it can take some time and require some guidance and really spaciousness to integrate the impact of that, and to do so in a way that it's going to stick, and then it's going to be something that allows us to continue on in our lives with clarified values, what's really important to us, and then how do we live in alignment with that. So that's psychedelic integration, but the arc of psychedelic assisted therapy, which is more of this, model of working with psychedelics for wellness goals. It's part of what I'm involved in as a medical doctor as far as bringing these therapies into our medical system. It's one way of working with psychedelic medicines, and people engage with psychedelic medicines in many different ways. What we might call recreational use or for spiritual purposes. And I think there's a lot to explore and think about in all of those different avenues. Certainly what interests me and where I'm, devoting my energy as a medical doctor and as a therapist is bringing it into our healthcare system. But I'm happy to talk more just about what psychedelics are and what that process is like.
Because I know there's a lot of people that aren't familiar. So, and we are seeing this psychedelic assisted therapy. We know there's even clinic openings in Canada now. So talk me through, what is the experience? What are people coming through that door in search of? And how do you take them through the process?
Well, I think, we're really in a time of desperation for many people for new solutions. Maybe they've tried the standard methods of antidepressant medications, maybe seeing a therapist and still feel stuck or still feel like, they haven't made enough progress or broken through in ways to achieve their goals as far as their own health, happiness, mental well-being. And with the research that you speak of, that's been coming out more and more exponentially so. People are hearing about it. Media is covering it. We're doing podcasts about this kind of thing. And so people are curious and they start to do their own research and they start to find the avenues and pathways to seek this treatment. I really believe that psychedelic-assisted therapy is a paradigm shift for us in how we address our health and well-being, and particularly mental illness and addiction. I started out my career in medicine really kind of bent on devoting my career to trying to make an impact in our healthcare system, to shift our healthcare system to one that is much more about healing and listening and less so about dictating and suppressing symptoms. And I experienced certain things in my youth and my teens interacting with doctors that I didn't find particularly helpful. Didn't know it would lead me through to psychedelics, but it makes complete sense now, because when you look at the paradigm of psychedelic assisted healing, what we really see is, first of all, psychedelic medicines are quite transdiagnostic in their effects. So they're sort of having this benefit across a spectrum of mental health illnesses, but it's the same medicine. It's a medicine like psilocybin, for example, which comes from psilocybe containing mushrooms. It's being used in clinical trials for depression, for tobacco and other substance use disorders. It's been used for end-of-life anxiety and a number of other things. And we're seeing tremendous results across a spectrum of different kind of disease categories or states. And why is that? I think it's a really curious question, something we're continuing to learn about. But what's something that I see is what I mean by transdiagnostic factors. There's these medicines actually go in, and when they're combined with a setting, which is really important, a well-supported setting, an environment that feels safe, nurturing, with a trained guide, facilitator, practitioner, therapist, whatever you want to call, a person who has a skill set to hold a person through a profound experience where literally your ordinary perception of reality is going to shift. Temporarily so, but it will, which this can be terrifying for many people who've never done such thing. But when you have those conditions present, there's a lot of cool things that start to happen in the brain. We're learning a lot through neuroimaging about how psychedelics can start to loosen associations in our brain. So things about how we think and how we perceive ourselves in the world, and the ways that our mind has become conditioned over time, over what we've been exposed to, our history and our life, suddenly, temporarily can be like loosened up and teased apart. While at the same time, new connections can start to happen. And this might be why, it's so common for people to have these aha experiences or sudden insights or experiences of feeling what they call noetic truth, like a truth that you just know is true, so true that you don't need proof from outside. So these types of experiences can happen under the influence of a psychedelic. People can reappraise how they think about themselves or even their choices that they're making in their lives, and see almost from a third person perspective maybe how they've been going about their life and interacting with substances like drug or alcohol, and come back with an absolutely different perspective than was ever previously possible. And part of this is because of this powerful effect of the psychedelic in the brain, combined with an environment that's going to support that person in their intention and what they want to get out of the experience. And I can't stress that enough. When you have a strong and clear intent and a really supportive surrounding, research shows that your outcomes are going to be better. When you do not have a supportive surrounding, there's no clear intention about what you're doing, these powerful medicines can work very differently. And people they experience bad trips, in a recreational setting. You may have heard about this. And I think it really is just a factor of the conditions around the use of the substance that are different, and maybe even unconscious material coming up that could be healed or could be addressed in a really productive way in the right setting that they're just not resourced for in that moment. So it becomes this scary or bad trip. So that's just a little bit about the experience. It can be very deep, very profound, and it really requires trained people and a very thoughtfully crafted environment for safety and for really getting the best results possible.
Fitness World's 16 British Columbia high-value, low-cost gyms are committed to helping people reach their fitness goals, whatever those may be. Exercise and movement play a pivotal role in supporting people's overall health and wellness, and it is Fitness World's mission to provide the facilities, services, and amenities to help you achieve your fitness your way. Visit fitnessworld.ca for more information.
And kind of on that note, I mean, I know in Canada thus far, as I understand it, ketamine therapy is something that we're already able to go as for health purposes, and then psilocybin kind of on the heels underway. I know that the trials are happening. When it comes to the therapy that exists now, how do you prepare somebody for that journey? What's the process ahead of them actually having the experience?
Yeah, so like at Numinus, where I've been working, I'm the senior lead of psychedelic programs there. Part of my job has been to develop our program. So what happens from when somebody comes in our doors up until the moment that they meet with our therapists and then embark on ketamine-assisted therapy with us for a number of different conditions or indications. And what's really important about preparation, number one, we really have to think about the ethical implications of psychedelic-assisted therapy, and part of ethics is informed consent. So respecting the right for autonomy, for a person to make decisions in alignment with their own beliefs, values, what they want for themselves. In medicine, across any intervention that you do, true informed consent is really important. So the person understands what they're getting into, what the potential risks are, what the potential benefits are. With psychedelics, it's a really interesting kind of situation because we can't absolutely for certain say what's going to happen for you in a psychedelic experience. We can kind of talk about the types of experiences that might arise, but we really have to do our best to make sure people understand and have their questions answered. That's part of preparation. That's part of feeling more safe and more comfortable with the experience that you're going to head into. And I mentioned intention. So therapists will get to know a client, get to know about their past, their history, maybe some of the things that have happened in their past, traumas, for example, conditions of their childhood, the relationships they've experienced in their lives, to kind of get a sense of where that person is coming from, and then help that person, first of all, speak to what their overall goals are, and then with that in mind, what their intention might be for going into the experience. So there's different ways to talk about intention. I think it's best when an intention is really simple. And Tanya Kumonen, who I've had the privilege of working with, actually when I was down with Gabor Mate in Mexico, she is been an integration director for the Temple of the Way of Light down in Peru, and she talks about just this simple method of show me, teach me, help me. So one of those as the lead-in, and then pick one of the core emotional states, fear, anger, like show me about anger or teach me about fear, because it's something maybe that you struggle with, or maybe it's on the other side, I don't know that I've ever experienced love before. What is that? Teach me about love or show me. So really just boiling it down, hearing the stories and what people come with, and then really boiling down to something quite simple. And then the intention then serves as an anchor or a rudder in the experience that a person can return to, and a facilitator or a guide can help that person to return to if they're feeling lost or at any point, struggling or having difficulty. So intention setting is a big part of prep. Also just kind of learning how to navigate tight spots. And you mentioned earlier mindfulness. I'm a huge proponent of mindfulness and really embodiment-oriented approaches and preparation for this work. I didn't come to psychedelics until 2011. It was really academic, my introduction. I went to the Vancouver Spirit Plant Medicine Conference in 2011, and It's actually coming up soon. It's been going ever since. And I think it was the second one I went to, but I went because Gabor Mate was speaking, and he was speaking about ayahuasca. And I was like, what's that? Right? Like, it was just like totally blew me out of the water to learn about this stuff. But, I think that learning and coming to that and really seeing that, when I was introduced to psychedelics, like my first medicine experience with ayahuasca was in March of 2012. I had already been practicing yoga since I was 17 years old. I had already been doing so much in terms of learning to come into my body, learning to listen deeply, learning to ground myself, learning to pay attention to my breath, learning to sit in meditation and watch and bear witness to emotions coming and going, and maybe pains coming and going. And I really think that type of practice can prime us to then alter our consciousness in profound ways and have big experiences that are not just mental. I mean, they're embodied, they're physical, and be able to really track that and stay present to it and get the most out of it and lean into the difficult places, which incidentally I think has a lot to do with healing and wellness too. It's like we naturally, human beings, recoil from what is not comfortable, from what feels scary, or we have aversion to, right? And then we're seeking after things that feel good. But if you go into Buddhism and you listen to what the Buddha said, it's really our aversion to what we don't like and our attraction to what gives us pleasure that actually keeps us in cycles of suffering. And when you actually look at like psychological flexibility, which is a transdiagnostic factor in mental wellness, it's actually this capacity to turn towards and to lean in to discomfort and start to expand our range of what we can stay present to. That actually makes us so much stronger and more empowered. It helps us to live in our bodies and in our lives, which are replete with pleasure and pain and the whole wide spectrum, with so much more fullness and not needing to hide in patterns to get away. So all that to say, prep. Mindfulness, embodiment, going into these experiences, learning with medicines to lean into things that might scare us or that might feel difficult, get to the other side and come out a human being with so much more capacity to meet life and to meet life in ways that we might have not even considered were possible before.
And we kind of started the conversation about integrating out of those experiences. So what is the process then as you've walked them through? Maybe some things have surfaced that you didn't know was present in the body. I'm sure there's probably suppressed memories that maybe have come to the surface for people. So what's the process in the aftermath? Because I imagine you do have this profound experience, and then it may be a little overwhelming on the other side to process that.
Yeah, absolutely. I mean, and all of that is why the prep and integration and the whole container is so important. And it comes back to part of this paradigm shift I started to speak to earlier, because also part of the preparation is helping people to learn that there's actually an innate healing intelligence inside them, right? Which is very different from Western biomedical paradigm of you go to the expert who knows more than you about what's happening in your body and is going to tell you what to do and fix things from the outside, right? So psychedelic assisted healing is actually about going, you know what, there's an innate, what you want to call it, inner healer or intelligence that is part of life and it's part of us. And if you want some proof, just, when you scrape yourself, if you keep that wound clean and dry, your skin cells will migrate. Your immune cells will make sure that the infection doesn't set in. And you don't have to think about that, right? That is that innate healing intelligence. It's this movement towards healing that we can observe on a physical level. And in psychedelic assisted therapy, we speak to this possibility that this isn't just happening on us or in us on a physical level, but on all the levels of our being, our psychological, mental, emotional, and spiritual parts and dimensions of who we are. So if we can trust that, or even just be open to that possibility, then when we're going into these experiences that might be difficult, but with support, this is how we sort of help people to lean in and to surrender into those experiences, because it's like this is coming up. Inner healing intelligence is bringing this up because it's ready to be healed now. You're resourced enough in this environment right now to meet this. And then it's like, what does the inner healing intelligence have to say about that black pit that you're feeling or experiencing there? See what's there. There's so much about coaching and guiding a person in an experience where you as a therapist are trusting that they have inner resources too. And this is the beauty of psychedelics, and what can happen is amazing metaphor and imagery, and the antidotes and the solutions can emerge almost seemingly out of nowhere, but truly I believe it's out of that inner healing in us to meet those moments. And in the moments where people are still overwhelmed, that's why skilled guides are so important. And that's why, I feel that having a background in trauma therapy, understanding the psychobiology of trauma, how trauma isn't about events, it's about how things that have happened in our past, either enduring circumstances of stress or incidents that have been extremely stressful and overwhelming, have impacted our nervous system, our brain, our biology, and left an imprint on us. And trauma is that imprint. It's that survival biology that hasn't turned off, because literally our organism doesn't know yet that that threat is over. And so it's not a rational thing. And this is really important to understand, and then to start to be able to recognize when trauma's coming up, as it might in a psychedelic session, what that looks like, and then how, as a skillful guide, how to really help meet that. Because in trauma, what happened is that a person was overwhelmed. Your ability to cope and adapt was overwhelmed by circumstances. There was no one there to help you. You were alone, helpless. And so what can be different is now, as all of this maybe fear or terror and the felt experience of that trauma is coming, what's different is, okay, you're not alone anymore. Time is on our side. We can slow things down, and we can bring in resource and bringing in everything that was missing at the time. And this is what trauma healing is about. And I think psychedelics, especially MDMA, can really be just powerful in healing that. So, your question is, how do you help people with these overwhelming experiences? That trauma background, in my opinion, is absolutely necessary. It's why I teach this stuff, I teach at the California Institute of Integral Studies in their certificate program, teaching a number of different programs. And what I'm teaching is trauma-informed, embodiment-oriented approaches to doing psychedelic-assisted therapy. This is so important. And then as people learn how to pay more attention to their bodies, how to breathe, how to be present with discomfort, to learn they have those resources outside of a psychedelic experience, they can take the resources that they've gained from that experience and then continue to practice that in their lives and continue to be supported in practicing that in their lives. And again, it's like widening that spectrum of what we can be present to. And in trauma terms, that's like our window of tolerance or our optimal arousal zone of our nervous system. I had PTSD in 2018. I had a series of accidents, multiple head injuries, traumas, and I got to experience what PTSD feels like from the inside. And it is hell. It's basically living hell. I wanted to jump out of my skin. I could not turn it off. It was like nails on a chalkboard inside my skin, a little pin drops in the corner of a room, and I'm startling. That window of tolerance was like a hair thin. And healing and recovery from that was growing that back again and growing that resilience, which we have the capacity to do. But it's about having the tools, the resources, the approaches, which we really don't have much access to in our healthcare system already as it is. And then, I think psychedelics can do a lot more even on top of that.
Well, and kind of speaking to that, because within Canada, as I say, there is a lot of exciting research happening. And I think even in the next 1 year, 2 year, 5 years, we're going to see some rapid advances. But for those that are seeking this type of therapy, in my experience, so you can correct me if I'm wrong, but it's a lot of people that have done a little bit of research and then are the ones that are seeking it out. So what's the temperature check right now, or the climate? Is this being well embraced as more science comes out, or is there a bit of friction? Because we do know that there have been a lot of stigmas that I imagine those barriers must be tough to break.
Yeah, there's certainly still resistance, stigma, fear. And I think, when there's something that challenges a dominant paradigm, it's always going to run into friction. There's going to be folks who have spent decades of their lives studying in a particular way of approaching things, and all of a sudden in comes something that challenges that completely. And I can empathize and understand why people might be afraid or scared or have resistance or think this is going to be dangerous or whatever ideas there are. Of course, science, it's great because we have more and more science. So it starts to become difficult to argue with the evidence that we're seeing. But at the same time, even with the research on psychedelics, our paradigm is so much about symptom suppression and giving a pill or giving us something to fix something that many people I don't even think are still interpreting or reading what's actually happening in these studies properly and thinking like, oh, it's just about giving this medicine to people. And like I said earlier, it's not. It is a combination treatment. It is context plus a powerful catalyst medicine that opens up what's possible in a context that's very carefully created. That's a concern I have really about bringing these things coming in to people accessing them as treatments, is that the people holding those spaces and offering the treatments really get that because it's different. We've never thought about pills or medicines in this way before. I think on the level of government and regulation, Health Canada recently reinstituted psilocybin and MDMA onto the Special Access Program, the SAP, which is a program that exists so that people who have a life-threatening condition, who have maybe been in a clinical trial to access a drug that isn't approved yet, can access that drug. So somebody who's had a new chemotherapy, for example, not yet approved, but it's helping their cancer. Now the trial's over. How do they access that so that they can stay alive until it becomes an approved drug? So the Conservative government took illicit substances, which included MDMA and psilocybin, off of this program in 2013. Fortunately, they've been reinstated. But now I think the federal government and Health Canada is seeing an influx of applications for access to psilocybin-assisted therapy and MDMA-assisted therapy through the SAP that I don't think they can keep up with. I know a number of colleagues that are writing these applications for depression with psilocybin, for example, and it's not easy. They have to prove they've done electroconvulsive therapy, deep brain stimulation, magnetic TMS, transmagnetic stimulation, all of these other therapies that are hard to access, have a lot of side effects. And if they haven't done them already, they have to prove that they have a reason to not before they'll be allowed to access psilocybin. So I think we're seeing more applications come through right now for end of life as an indication. It's an easier approval than depression right now. But it's like a trickle. It's very slow. So the access is slow. And I just think on the sort of whole regulatory front, more resources are needed on the government level to really integrate the science, integrate the best practices about how to deliver these medicines safely, and then open up access. And we're just not there yet.
Well, and I know there's a lot of advocates out there that are working to move this along. So as I say, the change, I'm sure, is afoot, but I imagine a lot of roadblocks and slow processes on the way.
Yep. I've been in it for over a decade, right? And it's like, when I first entered this field, it was very much fringe, but living in Vancouver was amazing. I just by by happenstance or synchronicity, just made these connections and became part of this whole community of interest in this form of healing. And then in the last decade, of course, public interest in everything has just taken off. Michael Pollan's book, How to Change Your Mind, and his piece in the New Yorker, and then now the Netflix series. And it's like more and more people are learning, and the whole boom of the corporate interest in this. And it's been incredible what's happened even in just the last couple of years in this field as far as its explosion and expansion. But access and all of that is still, we're grappling with it. So it's almost like this problem. More and more people know that these treatments exist, but the access still isn't there. So it's, I think people are feeling quite frustrated and challenged by it, and even seeking it through the underground, which comes with its own risks too, because there aren't regulatory standards. Underground practitioners may be excellent, or they may be dangerous, and nobody's holding them accountable, but people are seeking this. So, I mean, it's part of why I'm doing what I'm doing, right? It's like, I want people to be safe. I want them to access healing modalities that are going to help them. And it needs advocacy from within, from people in medicine and other places in the system.
Well, you're definitely part of the trailblazers. And as we talked about some of the science and approved uses right now, I mean, I've read some of the outcomes of coming to terms with end of life, and I think it's absolutely incredible. I highly recommend that you do some digging into the studies that have been done. Addiction, obviously, we know we have a massive crisis, and a lot of the findings in that space have been quite remarkable. And I think we can all agree that we need to start finding solutions in health for people in that space. But overall, I kind of started the conversation saying we all do need to take care of our mental health. So when you look toward the future, how could you see this being used on a grander scale? Do you see it being used on a grander scale?
Yeah, I mean, I think it's important to steer clear of thinking that psychedelic medicines and psychedelic assisted therapies are a panacea that are going to solve all the world's problems. And it's simply not the case. You have to zoom out and look at the broader system and go, okay, look at the problem of poverty. Look at the way that our system has disadvantaged certain groups over history and continues to. We have systemic racism still in our healthcare system, especially against Indigenous people. There are so many things that need to change and shift on a policy level so that at a bare minimum, people can have equal access to services and conditions of living that are going to support human flourishing, right? So we have to look at those social determinants of health, take them seriously, and make important decisions at regulatory levels and government levels to take better care of each other. And so once we have that in place, and I think, people can become more educated around what is a good life. I think we also need to zoom out and go, okay, we're all stressed out, running around. The cost of living keeps going up. There's all these global stresses, and it's almost become the norm to live in stress. And if you're not, it's like, what are you doing? Are you working hard enough?
Hustle
what's
culture.
Wrong? Hustle
where
culture.
We glorify that.
Totally glorify it. And actually there's certain privileged addictions like workaholism that get people ahead and are celebrated in our society, right? But does that contribute to optimal wellness or a happier life? It's questionable. So we also have to look at the impact of our lifestyle and how we're all collectively kind of agreeing and continuing to live and question that. And there's so many things outside of psychedelics that we could do in resistance to that. And I think, living, it's an act of rebellion for me to live my life to cap my days and to not work 80 hours a week and to prioritize connection with the community, play, all these things that stress will just shut down, right? So there's all these moving pieces, but in a healthcare system of the future where psychedelics are part of it, first of all, I'm also functional medicine trained. So from a functional medicine perspective, it's like root cause detection, what are the things in the way of healing, what's missing, looking at, I mentioned stress, but also what we're putting in our bodies, the quality of the food and the water that we eat and drink, And all of these sort of fundamental pieces, we're paying attention to that. Our healthcare system is supporting people to be educated and to make good choices. I think the healthcare system should not be siloed as its own thing, but actually, like if you look across ministries in a government, it should be distributed because our environment is important to our health. You see pollution in the environment, you measure that pollution in breast milk, right? It's there. So I think we need to also take this much more holistic approach of like health has to be distributed across different sectors, not considered its own separate entity. And then when people have the opportunities to optimize all these things, and then there's still blocks or there's still barriers or there's still some trauma that needs to be worked through that needs some extra support, then that's where I see psychedelics being this powerful intervention that can come in and can really help people move through that place. So not necessarily for everyone. And the last thing I'll say on this too is we need to move from a strictly like disease care system, like you spoke to one that appreciates that wherever we are on the illness wellness spectrum, there's always room to move the needle forward. And as citizens, we ought to have access to services that are going to help us move that needle forward from wherever we are. And I think that, psychedelics are being looked at for these serious conditions, treatment-resistant depression, end-of-life existential distress, and all of that because of the stigma that was associated with them when they were banned in the first place. The way to bring them back into what we will pay attention to and allow in research is to apply them to the things we just have no other, we've exhausted everything else. And it's so serious. It's like, okay, fine, we'll let them research the psychedelics for these things, right? Which is wonderful. And let's start to open the spectrum of what we're looking at psychedelics and how they could help. Like, what about health and wellness, fitness optimization? What about many other things? So I'm excited for the day when, and it's coming soon because research is exploding, where we start to look at these medicines and these approaches across that illness wellness continuum and really see where they can help us go, not only individually, but collectively. Because when we're more creative and we're more connected to ourselves, to each other, to the environment, we're going to start to build healthier societies. Like I say, I do think there's going to be this like feedback loop where, psychedelics and access to them in safe containers and in well-supported environments is going to help us move forward. And I'll stop. I could ramble on.
No, it's not a ramble. It's so fascinating. And I love how you talk about this holistic shift that truly we need to see in our healthcare system. It's something we talk about even from the physical fitness element. It costs the healthcare system $23.4 billion. The inactivity of Canadian citizens. 84% of Canadians do not get enough physical activity. And so then when you look as well of people that aren't using tools that are out there to help manage stress, and we know that we're a highly stressed society, there is so much work to be done. But that's why I so appreciate the fact that you came in today to just give us a little peek under the curtain for those that are looking to dig more. Trust me, you will go down a million fascinating rabbit holes if you wish to, because there is so much happening so quickly. And I think it's really neat that as someone of such a scientific caliber and incredible career that you had, and then to have this light bulb enter your life of this other element that we could potentially introduce to make mass difference in many people's lives. Very excited for you because I just can't even imagine what we're seeing happen now to be so hands-on in this process. It's history in the making, truly. When it comes to the science and research that's coming out, what are we potentially seeing when it comes to the physical activity connection and psychedelics?
I think this is a really cool place where research is going to expand because, psychedelics, they can open up so much, as we've talked about. And there are a lot of anecdotal reports like you see in forums online, people that are experimenting, biohacking, microdosing, and talking about how their use of maybe microdosing something like LSD, for example, is actually taking some limits off of their edge, where they're pushing in their endurance sport or in their lifting. And like, what are the mechanisms behind this? I think it remains to be seen, but it's certainly something that's being reported a lot. And when I think about that, I think about a few mechanisms. Like one of them is that our VO2 max and how far we can push into pain is not just limited by those physiological things, but also by like a switch in our brain. And psychedelics might temporarily expand that so that we can actually push ourselves harder. Psychedelics also, like especially the classical ones like DMT, psilocybin, LSD, they sort of loosen what's called the default mode network in our brain, which is like the part of our brain that is involved in ruminating and our ideas of self. So any sort of self-imposed limitations or negative stories or doubts that we might have that might be limiting our performance could also be positively impacted with psychedelics. And I think it's going to be a dose thing. And this is where, most of our conversation, we've been talking about macro dosing, right? Like a big psychedelic dose, whereas the microdosing field is a whole other thing. But there might be this sort of play here where these substances can help people to expand what's possible, also to start to even care about themselves a little more. And even in the macrodose context, sometimes there's this side effect that we see where people might have gone into an experience to, heal a relationship or something, and then they come out the other side going, I think I need to eat more greens and walk every day, right? And but it's just this awareness and this knowing, and that this is important. And often people start a meditation practice afterwards, and so I think psychedelics can also catalyze maybe a motivational process to just take better self-care of ourselves moving forward. So yeah, there's a lot of really cool ways that I think we're going to see that we can lean into human optimization with the assistance of these tools used consciously and safely that are pretty exciting.
One thing that I do like to leave people with, and I know this is somewhat putting you on the spot, but I feel like everybody has one. We are about cultivating motivation in people to live a fit and well life. So do you have a quote or a little mantra that you like to live by?
That's funny because, I cycle through different mantras or quotes, and I don't know if you're okay with like explicit language on your podcast.
Lay it on me.
But I would say in the last 6 months, the two mantras that I've been living by are fuck yes. So if it's a fuck yes, I acknowledge that it is and I move in that direction. Okay. And then the other one is it just gets better. And for me, living by those recently have helped me to lean into places where I'm maybe quivering a little bit or feeling a little bit of insecurity around expanding into. And those have been super supportive of the mindset that those two mantras for me get me into are a mindset that really helps me continue to expand. So yeah, that's
fuck yes. Dr. Devon Christie, so appreciate you sharing your knowledge with us today, truly.
It's been a pleasure. Thanks for inviting me to be on the show.
You've just listened to All Things Fitness and Wellness. This episode was brought to you by Fitness World. Your fitness, your way. Don't forget to hit like and subscribe so you never miss out on hearing from industry thought leaders and influencers. We are on a mission to help everyone live a life fit and well.